a lot of people in this group. One hand, please.
And on Google search, yeah.
Relates to nutrition. Very good. Respect for muscle wasting. How do you know? Okay, follow-up question for you. How do you know your patient has muscle wasting? What kind of inspection you need to do?
Muscle tone.
Okay, so you're going to grasp the size of the muscles, the quantity of the muscles, right? And then the structure of it. Alright, very good. Okay? Maybe this group. What are the another examples? It's too easy. Middle group. Next group, yeah. Alright? How do we know your patient malnourished just looking at the hair? Hair of your patient.
Broken skin, keratin, right?
Anyone?
Speed. Yeah.
I'm talking about the middle group, yeah? Yes. Speak louder.
Thinning of the hair.
Thinning of the hair. Okay. And what does indicate? Thinning of the hair, that's mean they are lack of what kind of nutrients? Vitamins and minerals. Okay, that's a bit too broad. Okay, but of course, yes, getting there, but that is a good guess already. Okay, but again, you have to identify what would be the root cause for thinning of the hair. It could be due to using of the cosmetic products and things like that. Stress could induce also, not necessarily specific for nutrition. Okay. Alright, then we also do dietary assessment. How do we do dietary assessment, ladies and gentlemen? So in the clinic, we ask patients, we can do many things. Like we can ask 24-hour recall. 24-hour recalls meaning that yesterday, when was you had your first meal? Dah mention dah. Faham muda lagi. Okay.
Around 9 o'clock.
Okay, around 9 o'clock you had your first meal. What you had during your first meal?
My biscuit and coffee.
You have biscuit and coffee. How much biscuit? What kind of biscuit you have? Is it just a plain biscuit without cream, or do you have any cream on it?
No, it's a biscuit.
Yeah, just a plain biscuit. The rectangle one. Alright. How many pieces? 3 pieces. Okay. And then you have coffee. 1 glass of coffee. Do you put any milk on it?
It's 2 in 1.
2 in 1. Okay. Alright. So the 3 biscuits already 60 calories. So plus another 150 calories is from that 2 in 1 drinks. So we kind of go through that whatever you are eating within 24 hours all the way until before you go for sleep. Right? That's 24-hour recall. And we can also do food frequency questionnaire. There are lists of food items. You ask patient to do that, or patient can fill up there by themselves. And then from there you can calculate the amount of calories, macronutrients, energy, protein, fat, and also micronutrients from what your patient eating. Okay. Another thing is we can also do diet history as well. Okay. Not much different from the 24-hour recall that I mentioned to you just now. Okay, so that diet assessment. So we also looking into the client history. So all of these, after we obtain all of this information, then we can come up with what is the nutrition diagnosis for your patient. Okay, so that's multi-dimensional approach. Next. All right. So there are, this is specifically, I want to touch on the malnutrition because malnutrition is a big issue in the hospital. The prevalence is around 20% in hospitalized patients. Yeah. So one, how to identify patients who are malnourished? Okay. The recent criteria that we are using, because of course there are many schools of thought when you say about malnutrition, isn't it? Malnutrition has such a huge spectrum. all the way from underweight to overweight. Even overweight is also considered, overweight and obese is also considered as malnourished, isn't it? So such huge spectrum. So it's very difficult to come up with a consensus understanding what malnutrition is. Okay, so GLIM is one of the reputable body that define what will be malnutrition. So in GLIM, they identify based on phenotypic criteria and etiologic criteria. Okay, phenotypic criteria meaning that if your patients, right, have any weight loss, and they have low body mass index, and they have reduced muscle mass, yeah. So any of those criteria, so you're going to tick on that also. And etiologic criteria, what will be the etiology why they experience malnutrition in the first place, right? For instance, if your overall energy total diet intake is less than 50% of what they used to eat previously, all right? And this has been consistent over 2 weeks, so you're going to tick on that also. And if there's presence of any acute disease or injury, they come to you with burn, all right, for instance, or they come to you with multiple organ failure, AKI, acute kidney injury, or chronic disease related. For instance, chronic kidney disease patient who come to you. So that is chronic CKD patient, for instance, has a persistent level of inflammation. So you're going to click on that. So ladies and gentlemen, if they satisfy both phenotypic and etiologic criteria, any of those, so your patient is considered as malnourished and you have to make intervention to that. Alright, fine. Okay, so this is an example. How do we identify muscle mass assessment just now? There are many. Can you go back to the criteria again? So you remember the last one, reduce muscle mass, right? From on phenotypic criteria, how to do that? You can do to next slide. Okay, how to do that? There are some technical approaches. You can use BIA. What is BIA? Bioelectrical impedance. Pernah buat? Pernah buat? Tak pernah pergi fitness center? Wow. Not interested at all to go to fitness center.
Money
Doctors kena
problem.
fit lah kan? Right? Okay. So that's BIA is pretty much available everywhere right now. Even in the gym, they also have BIA, bioelectrical impedance. We have DEXA. I think you know what DEXA is. We have CT scan and ultrasound that you can use to identify muscle mass. Okay. Just now when you do PE, physical examination, that is qualitative assessment, right? So using this technical approach, you can do more quantitative assessment, right? However, don't worry, if you are posted to a very rural hospital, you don't have it, okay, that's fine. We can do the clinical approach, you can do anthropometric, measurements. It's very cheap, you can just measure calf circumference, you can do mid-upper arm circumference, right? And you can do physical examination, right? If you cannot really have all those technical devices, okay? Right? So from there, you will be able to identify what kind of patient satisfy the criteria of low skeletal muscle mass. Right? Okay, this is the screening and diagnosis process of malnutrition. As we mentioned, we already talked about nutrition screen when and triage your patient, and then do some of diagnostic assessment using GLIM criteria. For instance, we diagnose malnutrition and you provide you grade them according to their severity. Okay, this is our activity today. Okay, let's take a look at this scale. Okay, this was me when I was in Bangladesh. Okay, my field of interest in dietetics is I'm a renal dietitian. So basically, I'm seeing kidney patient, right? So and looking at kidney patient diet. So from all spectrum, all the way from CKD to dialysis to transplantation. Okay, all right. This was a 48 years old Bangladeshi. She has limited activity of daily living. Do you know what is ADL? You know? Sorry? Yeah, what is activity of daily living? Yeah, okay. So she would need help in order to go to the bathroom and so on. She cannot really cook by herself. Yeah. So limited activity of the so because she was on wheelchair, so because of that, all the meal was actually being were actually being prepared by her family, by her spouse. Yeah. And in terms of medical diagnosis, she's been end-stage kidney disease and currently as secondary to diabetes mellitus type 2, and she has been on maintenance dialysis, yeah, for the last 4 years. Okay, height 160 centimeter, post dialysis weight was 93.5 kilogram, dry weight was 90 kilogram, and no significant weight changes were noted. Yeah, and average interdialytic weight gain was 4.5 kilogram. Okay, do you know what's those terms? What is dry weight? What is IDWG? Yes? Who want to try? Yes, gentlemen. Yeah, what is IDWG?
Maybe the difference, direct difference between the before dialysis and after.
Okay, you got some idea there. Okay, typically in Malaysia, we do for maintenance dialysis patient, they come to the clinic 3 times in a week, right? For instance, they come on Monday, and then the subsequent session will be on Wednesday, right? So interdialytic weight gain, meaning that in between those dialysis sessions, how much they actually gain weight, right? So why is this important? This actually telling you a lot of story, how well your patient is comply, for instance, to the fluid intake, to the sodium intake, okay? So if they don't comply, definitely their IDWG will be very high. Okay? Alright. Appetite fair, no changes from the previous 2 weeks here. Diet intake is about 1,900 calories, only 50 gram protein, yeah, and no significant changes, it's pretty much the same. Meal was prepared by her husband and eldest daughter, and lab value albumin 37, blood urea nitrogen 2.8, creatinine 221, sodium 140, potassium 4.5, chloride 100, phosphate 1.55, and blood pressure was 143 to 89. Okay, next. Alright, okay. So I want to work in, you have 2 big group here. So setiap meja ni, you pecah kepada 2 kumpulan. Boleh? Okay, setiap meja pecah kepada 2 kumpulan. Okay, work in your group. Okay, if you were to complete a nutrition assessment for Mrs. K, what additional information needed? Okay, apa additional information that you would need in order to have a complete nutrition assessment for this patient? And what are the nutrition screening and nutrition assessment tools that can be used to screen for nutritional risk and diagnose the nutritional issues? And what are the limitations of those tools? Okay, and based on the clean criteria that you have went through just now, okay, try to diagnose whether this patient is malnourished or not. Okay, based on the available data. Alright. So next. Okay. You can scan this. Okay. Setiap group ada satu sahaja jawapan. Boleh. And then give your group a name. Right? Okay. Okay,
So we
I
are
think you
group
have
for this.
X. And you have 15 minutes, yeah? 15 minutes to work on this. Okay, let's do it.
How to divide the group? Okay, yang belum scan tu scan group, yang belum scan tu scan group.
Scan je.
Satu jawapan saja
Aina
untuk
ada
scan
scan.
group.
Okay, who's doing the answers? Who's going to type on the answer?
Not type, more like write. Oh, type.
Yeah, the type.
I can type.
Okay.
Okay.
So yang additional information that we want to acquire from Mrs. Kayla. Right?
Faham. I got the
guess-
answer.
Yes, yes.
He got the
No.
chat GPT
But I know how to use ChatGPT efficiently. There's a
I think
difference.
what's best is kita list dulu lah information apa yang kita dah ada.
Tengok Telegram.
Then, okay, sure.
Nanti kita compare je.
Alright. Baik tu.
Macam mana cari jawapan? Nanti kita kena explain kenapa kita jawab tu. Nanti aku macam tengah fikir.
Kenapa ni? Dah ada ke?
I'm using GPT.
Can you send back?
Ha?
Can you send back? I mean send to me.
Telegram?
So siapa je satu group? Jom
Siapa yang
kita-
group ni tak faham. Kita lesak sini. Sak.
Ada berapa soalan? 4 dah.
So aku hantar kat Puteri for reference
Dua
lah.
orang buat satu soalan
tak,
lah.
tak copy paste lah maksudnya.
Senang sikit. 2 orang buat satu soalan. 2 orang buat satu soalan. Boleh?
Boleh juga.
Nah dah.
可以。
Okay. We are two.
Alright. Which question are we taking?
Nutrition screening and assessment tool for. What's the question? What are the nutrition screening and nutrition assessment tool that can be used to screen the nutrition and diagnosis nutrition?
Complete nutrition ni consist of
Kami ikut yang tu. Siapa tadi? Ikut yang tu.
macam easy thinking lah. Everything yang we ask of you. Dietary breakdown. Is it in our Telegram website?
Tolong cari jap ini apa beza dia?
I type out.
Apa beza ni MAS dengan NRS? Ini cari ni pula. How much do we cost? Golden rate times 100.
No need already or we need to scroll there also.
Use the screen there.
We don't scroll lah.
Ada.
GPT je dulu.
Ah.
It's an Edison. Yeah.
No, it's not an answer. It's not an answer. It's a reference. Send lah.
Yeah. Thank you. This is the answer that
Oh, dia sebenarnya dua-dua pun nak cari benda yang sama macam weight loss and all during diseases. Tapi mask lagi accurate lah berdasarkan
Mas is more accurate than MN.
dia more specific as to what is, they can predict what is the cost lah kalau banding daripada NRS. Tapi dua-dua pun nak cari apa punca weight loss and everything lah.
Tulis je, type lah dulu kat dalam Telegram. Dia obese kan? Ya, orang nak kata she's living with obese, right? She's living with hematology.
Okay.
She's obese kan?
Okay, noted.
Cepatlah, she's living with obese kan?
She's living with diabetes. Yeah. Okay, sabar. Oh, let me write also. You say nanti kita dalam balik Edison first.
Jom Adi, basically all of this is to assess this provided information.
Haa.
The patient says, what? End-stage kidney disease and also diabetes mellitus, right?
Sebab I tak faham sangat soalan ni sebenarnya.
Yeah, that's the thing. I'm also still not
Confused.
Yeah.
Medication use. Wait, we go by family history, right? Family history.
Boleh tolong tambah kat situ BMI. Dekat your question lah. The risk, the limitation. Yang assessment.
This one, that information needed. Comorbidities or complication related research. For example, dia ada type 2 diabetes dan mana tahu kalau dia ada luka tambah nanti boleh juga. Actually we can this one also. It's like disco disease. Yeah, due to the disease you also boleh? Like this cardiovascular disease for nutrition. Maybe cardiovascular disease lah. Kalau cardiovascular disease macam-macam kan hypertension kan. So far going good.
Yes. Sorry, doctor. Is blood pressure clinical assessment? Is blood pressure clinical assessment?
Yes.
We need to combine our answer and put it in the platelet.
Yeah.
Who's going to combine? You are?
Tunggu 2 minit baru kita combine.
Okay.
Okay? Ni 2 minit.
So maksudnya kalau yang ni satu double. So yang dua is fine.
Nausea and diarrhea. Elementary. Kalau metformin, diarrhea lah. If metformin, sebab dalam PIS hari tu pun metformin. Detailed breakdown of a dietary intake, including meal timing, specific food consumed. Macam doktor tanya earlier before. Detail.
She's using the what? 24 hours. Okay, so it's not 24 hours. The record food frequency questionnaire and diet got 4 marks. And
Okay, those who are typing, please make sure you write down your group name here.
What is our group name?
Give your group a name and then write it down.
Jadi
Kau dapat cari tak yang biochemical
Medication
or each one like what value indicate apa? Kau rasa perlu tak?
I just letak clinical assessment je. I tengok apa yang I tak kata dia indicate apa.
Yeah.
I just kata in general apa dia.
Which test they want to conduct lah.
Cepatlah question tu you jawab. Okay.
Vitamin DDI and prescribe. Better, that's it. CD past medical record to track any rate changes or wait, Eddie,
Tengah tulis. Mana you punya jawapan?
I'll send you our answer.
More or less the same saya rasa dah. Cuma I baru nak mula to evaluate this one. Jadi saya tak sempat.
Nutrition screening.
Masa kecederaan.
See what you have done so far?
Ni.
On nutrition screen just MUST is enough. That's what they said.
And apa?
MUST tu dia cukup. MU
Mas.
NRS boleh tapi sama.
Okay, first question done.
Question 1.
When the patients approach the dietitian will perform the subtractive first.
Dan banyaknya.
Medically, I guess so. But then kalau saya, okay, abdominal dietitian, I guess we will refer the patient right after like diagnose lah or present something related to diet, malnourishment. Macam dah doktor cakap
Question 4. 4 pula 3. Okay. Question
we can tell them you need to
Question 4.
dietitian. So dietitian will bagi tahu plan dia.
After dia reduce weight, or while dia reduce dengan reduce weight, rasa kita yang bagi ubat. I mean, while dia
Tapi diagnostic related. For diagnostic, reduce
Tak, I tengah tunggu orang tu. But in terms of my part, finish lah. Kemaskan dia lah.
Ni semua Adi dah ambil lah. This one is for dietary assessment. Okay.
With my copy paste je.
Ni tak sempat. They have so many articles but mana nak sempat nak cari which.
So tu lah saya tengok artikel tu dia just spam benda tu. Sorry.
Yes, okay.
Something is
depends on 你是要什么样的人。
cepat guys. Cepat guys.
我还没接受这个水的。
RM50. Cepetan sih.
Kita baru ada 4 kumpulan. Ada lagi yang belum post. Cepat. Please close it now. Okay, five groups.
Can you send me the? Do you have the picture of the QR code?
No.
Apa tak? Oh, do you have a picture of the QR code? Ada gambar QR code tak? Okay.
Doctor, can we have the picture of QR code for a while? We missed it. Can you have the picture of QR code for a while?
Jom. Thank you.
Finals.
Group apa nama group?
Wait, nama group apa?
Nama group. Hungry.
Last class.
Hungry. Okay.
Okay.
French fries.
Cepat.
Attention please. Let us discuss.
Dah ke?
Okay, saya tertarik dengan Puspanita Gong. Siapa Gong? Mana Puspanita Gong? Mana Puspanita Gong? Dah balik. Okay. Gentlemen ya. Ingatkan Puspanita
Tu apa?
ladies, right? You right? Can you help me to scroll Puspanita? Okay.
Puspanita is Puspanita. A group of students.
Alright. Can I have a representative from Puspanita? One person, please come here for Q&A. Okay, cepat. We want to finish this.
We got a full answer already.
Yes.
Can send
Yes. I'm sending it.
Okay, please come. One person, please come here. Nanti satu group dengan leaders. Alright, come. Cepat.
Group kita siapa mau pergi?
Allah, stres.
Send the answer already. Mana ni?
Our group is French fries.
French fries.
What's the group name? French fries.
Mana ada?
Tadi kamu. Ini ada. I tak send.
Wait.
Okay. The first question is, if you were to complete nutrition assessment for Mrs. K, what additional information are needed? So, your indication, if you identify there are three things, three basic things: anthropometric, biochemical, and clinical methods. Yeah, anthropometric indices, BMI, waist circumference, body fat composition. What is this needed? Any reason for that?
Didn't put. Oh, reduce calorie.
Siapa yang bertanggungjawab boleh datang.
sampai sekolah.
Macam boleh goreng-goreng je lah.
But I like the name Puspanita Gaon. Puspanita Gaon. Persatuan Suri.
Cuma ada satu je persatuan kat dalam sekolah batch kita.
Puspanita.
Dengan persatu pemati kita.
Siapa tu? Puspanita siapa dia punya presiden? Apa presiden dia?
Akhir.
Akil India. Akil Melayu. Akil Melayu. Akil Anwar. What the heck? Kenapa dia orang tweet? Ni apa ni?
Nanti goreng je, nanti goreng je.
Saya dengan Ming Xuan kita orang apa? Tweet.
Right, yang belakang dengar tak? Dengar? Jelas? Okay. My question is, okay, this group has outlined, okay, untuk anthropometric indices, we would require BMI. We would require, we would need a waist circumference and also body fat composition.
I tak banyak.
Right? So my question is,
rasanya tak ada
why
yang
do you need
tertunda.
these three items? Why? How does it relate to nutritional status of this patient? Yeah.
I hope our group can
Tadi EKSD apa? Tadi EKSD apa? EKSD? ESK.
Kan ESD kan.
End stage kidney disease.
Kan EKSD, ESKD. Tukar.
Tapi kita tak ada yang ni.
Macam mana
tadi? Kita tak ada ke anthropometric ke dia tak tanya? So what is question one actually? Kalau dia tanya senang dia nak jawab. Cuba kalau dia tanya CRP tu apa? I purposely do that. Nak idea apa mana? Mana?
Bawah. ESKD.
Huruf besar.
ESKD.
Anthropometric indices for BMI, with circumference and body fat composition, because we want to know whether the patient has obesity or not.
Right. So basically, what they are saying is that by measuring BMI and so waist circumference and body fat composition, so you kind of know the status of body weight status of this patient, yeah, and I think you want to try to link this with the risk of cardiovascular disease, yeah. But is it in this case scenario, is it that important to have all these parameters? If you were to come with just one, you don't have much time, right? So if you want to just select one, which one will you select? Can I see other group also? Okay.
Sebab boleh dia.
Right, that's quite interesting. The Barbies, apa the Barbies?
Barbie girl in a
Where's Barbies?
Hey Barbie. Hey
Baik,
Barbie.
angkat tangan. Nak angkat tangan pun malu Who's Barbies?
Hey Barbie.
Alright, okay.
Barbie. Oh Barbie.
So, it's a bit contrary to what the Barbies is saying here, because they are basically looking at the muscle wasting instead of looking at weight status. Yeah. So, which one do you think is more appropriate in this case, right? Okay. Any thought on the rest of you? Okay. So let us go back to medical diagnosis of this patient. Yeah. What kind of cases is this? End-stage kidney disease, right? Patient who already end-stage kidney disease, undergoing dialysis on a 3 times in a week basis. Okay. So what do you think about nutrition status? What is your anticipated nutrition status for this case? What is your anticipated nutrition status for this case? Are they going? Are this kind of patients in this kind of group is going to be healthy? No. So it's not healthy. So in what sense not healthy? Oh, okay, she's overweight, obese. Is it good or bad thing? It's bad thing. Okay, so you expect this group of patients to be more normal weight. Is it? Normal weight meaning within the normal BMI. Is it? Okay, right? Maybe because you haven't really the disease process yet. Belum. Semua healthy at this point yet. Touch a bit about diseases, right?
Betul dah.
Sedikit.
So in CKD patient, ladies and
Hari ni
gentlemen,
last class dulu apa benda sedikit.
kalau you
Dah habis
tengok
dah.
dekat dia punya graph
Sebanyak.
survival curve, ya. The more BMI they have, the better survival this patient has. Is contradict to what our general healthy population has. In general healthy population, that's why we told our patient, we told healthy general people, okay, don't go for overweight and obese, because as you get more overweight and obese, you have higher risk to develop other metabolic diseases, right? You have cardiovascular disease, you have some other complications, right? But for people with end-stage kidney disease or any organ failure, right, the scenario is what we call as reverse epidemiology. Okay? Reverse epidemiology, meaning that what rules we actually use for general healthy population is no longer valid for this kind of patient. Yeah. So, but later on, instead of just looking at weight, furthermore that we have to do is actually looking at the muscle aspect. What dictates the survival of this kind of patient is actually muscle. How much muscle they actually have. It's not really weight, because weight can be contributed by fat and muscle.
We cannot use.
Right? Okay.
Yelah,
So
we
very
cannot
good.
use lah because
Right.
the
So
body
that the first one,
function
the
is
second mistake was
Different lah.
okay.
By seeing
Other
their
things I
the
agree with you.
nutritional
Sorry.
requirement and tak bagi apa yang diorang
You have to look at the biochemical methods, lipid profile, glucose you don't really need, but it's okay because this is type 2 diabetes, alright? But this kind of patient, when they go for end-stage kidney disease, their blood sugar, most of the patients tend to be stabilized. Not sure that. Clinical method, list of current medication taken, very important. That's good because you want to see any drug-nutrient interaction. Yeah. What kind of issues some of the medication may cause, changes in appetite, history of predisposing comorbidities such as. What do you mean by that? Heart disease.
before
Okay.
that.
Yeah, hypertension, diabetes is already there. Yeah. Alright. Okay. Good. Any things that you want to add on? Boleh tengok yang group lain. Okay. Sebab bowling day. Alright. Apa sebab bowling ya?
Sebab boleh
Okay.
kita punya
What
nama
are
tak best
missing
lah.
probably from diet assessment? You did outline about additional supplements. Good. Alright. So those are things that you want to look at also. You outline on MFPE, very good, nutrition focused physical examination. You want to examine hairs, skin, subcutaneous fat, muscle wasting, any sign of symptom of micronutrients deficiency, alright? Which is many of these patients are susceptible to. Okay, well done sebab boleh date, alright?
So fun.
The case is pretty general. Aiziga, Billy. Huh?
Benda Aizika.
Alright, I think pretty much the same.
Club juga.
Okay, move on.
Come,
Okay.
come.
Thank you very much. You can see.
Just now doctor mentioned about if this kind of patients, the BMI should be higher. Is better.
Okay, question number 2. What are the nutrition screening and nutrition assessment tools that can be used to screen for nutritional risk and diagnose nutritional issues? Okay. Number 2. I want to find something different. Nugget McD, what did they say? Okay. Budak belakang.
Kenapa dengan
Alright, I think Mandy got it correct. But
You should tanya doktor sebelum kami do on conclusion.
Nugget McD, you chose MNA. Why MNA? Particularly Nugget McD siapa? Okay, terus lapar saya. Okay. Right, why MNA? Specifically? Come here, come here. Mai depan, mai depan. Kenapa MNA?
So today kenapa kami pilih M&A because kalau dalam M&A tu dia ada aspek mobility and as we know our patients punya mobility is limited and then another reason is because another aspect is kalau dia ada any acute disease in the past 2 months, so maybe that could also be a factor. That's why.
Alright, I kind of agree with that. And for this M&A, as I mentioned just now, is being validated among elderly. So many of dialysis or advanced patients are in the category of the elderly, most of them. Alright, well done. So another thing is you have to understand. Okay, I think let's move to question number 3. What are the limitation of these tools? Right? Siapa group mana yang nak cuba? Biotin perhaps? Biotin mana? Biotin? Dah apa? Lempar batu setinggi tangan ya. Siapa biotin?
Form 6 dah tahu result ke?
Which group? Can I see? Okay, yes. Okay, thank you. Can I have one representative from Biotin?
Faiz.
Okay, thank you, Faiz.
Can I see? Do you have the link? The link for yang semua Japan ni?
Yeah.
Nak tengok? Ya.
Sorry, you have to come all the way.
Right.
Okay.
Sekejap.
Explain a bit about what are the limitations in your thought.
For limitation, there is a potential cultural bias. There is a lack of specificity.
Arigatou gozaimasu.
What happened to all of you?
What do we mean by cultural bias?
Apa yang entry tertentu makan,
Living with.
macam mana the body.
Living with what?
Okay, kejap now we are talking about nutrition screening tools. Nutrition screening tools such as your MNA just now, MUST, MST, right? So you're talking about cultural bias. I just want to know a bit more. So you're mentioning about what certain athletes eat different kind of food. Is that what you mean by bias?
I think more than 3 times.
Okay. But in that MNA or MST, does it include anything about food, type of food they're eating? Ya ke? Tak tengok kot. Ada tak? Ladies and gentlemen, dalam the screening tu ada tak dia include any type of food? Tak ada kan? Okay. Maybe not that much, but it's good, let's try. Okay? Not that much. What else? You mentioned about lack of specificity. This is good. Okay, lack of, is that one? Lack of specificity for certain population. Reliance on subjective information and variation in accuracy depending on the individual condition. Explain a bit more. Yang last tu.
Orang kan ada condition yang macam very tinggi metabolisme semua. So tak fair lah kalau contohnya dia ada problem untuk metabolize slow metabolism. Dia nak pun slow semua. So dia makan banyak tapi dia keluar sikit. So macam tak fair lah. Dia slow macam nak hilang berat.
Jangan.
Okay, thank you very much. Okay, that one, alright. So remember, the tools, ladies and gentlemen, this tool for us to quickly diagnose who are at risk of getting malnutrition, getting malnourished, right? So that you can actually do further assessment. So yes, of course, there are variation in accuracy, but again, those criteria,
The battery is amazing.
meaning that maybe we would need additional criteria to diagnose whether or not you or your client have malnutrition. So you may miss out certain criteria. Okay, I just want to ask you to look into those certain items such as in the MUST, right? If you can look at that, they actually using BMI or weight, right? BMI or weight. So there are certain cases, certain situations in which BMI may no longer be or can actually doesn't really play important role, right? For instance, you can have obese patient with BMI high, doesn't really fall any of a lower BMI, lower body mass, but that obese patient is actually malnourished. Is it even possible? Tak possible. Can obese patient be malnourished?
Possible.
Okay. Kat situ ada slide saya tak?
Why can't diabetic patient be mana? I thought malnourishment tak necessarily
Yelah,
tinggi
I
atau
can-
rendah kan?
That's why I say possible.
Okay.
Less of vitamin K.
Alright, ladies and gentlemen, for this patient sebenarnya this patient is malnourished.
Oh.
So you can see what I'm doing right now over there. What I'm doing actually, I'm doing the skin fold caliper, right? I'm actually measuring the fat underneath of her tricep. Okay, so upon examining that, it's actually very difficult to separate out between the muscle tissue with adipose tissue. Yeah. So her muscle tissue is already become very stringy. Okay. If you can do to yourself, try to separate out, between your fat and also muscle tissue. Do you know how to do that? Okay, 90 degree macam ni, right? Okay. You boleh daripada siku boleh naik ke atas. Okay, dekat sini you boleh rasa kat mana muscle. Okay, and then you can genggam sikit. Now you can actually separate out between your muscle dengan right.
Cancer. That's your fat.
Okay, bro bagi comeback next year.
Right.
Boleh dengar ke?
Besar gila tu.
Thank you, Tio.
Faisal, kau fikir
So
apa tu?
now you want to separate out muscle dengan fat tissue. Macam mana nak buat? Okay, minta your patient buat 90 degree macam ni ataupun macam tu. Alright, okay. So now daripada sini you can pump it all the way. Okay, and then ask dia and then you can actually feel the difference between muscle. Muscle now is become stretched. right? And then the fat tissue, right? So there are space in between your fingers. You see? So there's space in between your fingers. If there's ample space, that means there has adequate amount of fat tissues lah. Meaning that
Sudah
there's
fat.
no sign of fat loss. Yeah. But if the space between your fingers is
I have
very
a lot of fat.
little,
Tak banyak.
that's mean that the
Because I'm
patient may already
please.
lost the fat tissue. But more importantly, just now I'm also palpating the muscle, the tricep over there, so I can feel that the muscle is firm and it has a good shape and also a good quantity, right? So that's mean there's no indication of muscle loss over there. Muscle loss, ladies and gentlemen, nak senang lagi, you boleh tengok dia punya temple dia also. Temple, okay, temple kat mana temple? Kat sini okay. Kalau ada cave ataupun dia apa bahasa Melayu dia melengkung ke dalam di sini daripada segi observation, and then you going to feel it whether they are firm, okay or not. Okay, cuba nak bayangkan orang yang well nourished. Kalau yang lelaki kan, dia orang pakai belt kan, boleh lipat belt tu pada dua. Okay.
Lipat
So,
belt.
rasa masa yang untuk orang yang well nourished, dia akan rasa macam you lipat belt tu dua. Right? You rasa firm. Tapi kalau yang untuk malnourished, you imagine you letak air dalam balon tapi tak penuh, then you picit balon tu.
Oh,
Rasa muscle dia
faham.
Ni macam mana buat?
Right? Faham ke?
Belt tu.
So
Nah,
these
ni.
are some of the physical assessment that you can actually do your patient. So in this
Very
case,
hard, right?
In this case,
Kalau hard maksudnya
I
dia
found
tak
that,
malnourished.
the patient already lost a lot of substrate.
Kalau hard maksudnya tak malnourished.
Dan juga it's very difficult to actually the muscle itself is actually very stringy and also it is not really firm anymore. Okay, so which may indicate the patient actually losing some amount of fat as well as muscle. So in this case, ladies and gentlemen, looking to BMI alone, you may miss out that this patient is actually malnourished. Okay, kalau kita tengok dalam green criteria ada BMI, right? So kalau ikut yang tu sahaja, you akan miss out. This patient is actually malnourished. Faham ke? Alright, okay. Another thing, kalau macam mana nak check this patient has a good muscle function is you can do the hand rate dynamometer. Tahu hand rate dynamometer? You can search ke internet macam mana hand rate dynamometer, right? So from doing that, you can actually test the function of the muscle, right? Last question.
Grab ke grab? Grab. So sorry.
Alright, ladies and gentlemen, last question from me. Based on Gleam criteria for diagnosis of malnutrition, is Mrs. K malnourished?
Yes. I don't know.
Yes. Ke no? Kat mana yes? Give the evidence. Kat mana yes? Okay, let's take a look into Gleam criteria. Can you view the PowerPoint slide?
Betul lah.
Alright, let's review this. Okay, weight loss. Does patient experience any weight loss?
No. I record this screen.
Weight
So.
loss. Okay, so this criteria doesn't fit. Low body mass index. No. No low body mass index. Okay. Low skeletal muscle mass. How do you know? No information. So I just give you the information just now. Alright? So based on that information, what do you think?
Masa dia string.
Yes, okay, so it's a tick there. So low skeletal muscle mass, and in fact, when we did hand rate dynamometer for this patient, the score also low, less than 5 percentile. So we indicate that the muscle function is also pretty low. Okay, So taking a look at etiology criteria, low food intake. Are you sure? No?
Jama Dynamo.
Sekejap yes, sekejap no. Berbolak-balik hatinya. Apa jawapan, ladies and gentlemen? What is your indication that this patient has no reduced food intake? Okay. Despite she's eating 1,900 calories, does it actually meet her requirement?
No.
Fatigue. And
Okay.
then check
It's almost
whether
meeting her requirement,
as
bro.
increased
But if
heart
you look
rate,
into
blood
her
pressure,
appetite, it's
cardiac
pretty
output,
fair.
cholesterol,
Her appetite is fair, it's not good
physiological
appetite,
function.
right? So there must be some underlying issues such as uremic retentions that may cause the patient to have such a fair appetite. Okay, so I'm going to KIV on that. But disease burden or inflammation, does patient have a chronic disease related? Yes, okay, that's for sure,
Normal
yes.
diastolic
Okay,
function,
so in this
immune
given criteria, the patient already fulfilled phenotypic and etiologic criteria, isn't it? So it's malnourished. Yeah, it's malnourished. Despite when you look at the patient, in the first time you look at the patient, and this is quite obese patient, you won't think that this kind of patient is malnourished, right? Faham tak? Okay. Any questions so far?
No.
Before we end our class today?
Last class.
Last class.
Hopefully.
For this year.
Hopefully.
Hopefully.
We look so
tired.
Phenotypic is
look so big.
tak faham. Can you repeat?
哦，就是请一个
Common your
小
question.
时所思，好了。
Open up.
Open up.
Yes, she is.
Open up.
She has those
Open up.
symptoms.
Kau buat up.
Why?
一定要有一个。如果一边就
Remember for phenotypic, okay, there was a quite a question. Untuk phenotypic criteria, you have to measure three things, right? Weight loss, BMI, and also low skeletal muscle mass. Okay, so for low skeletal muscle mass, if you don't have BIA in your setting, if you don't have a DEXA, you don't have to go for those expensive. You can do physical examination, right? So for physical examination, to know whether your patient is losing skeletal muscle, there are several sites that you can do. Okay, first thing is on your temple. Okay, because the first thing that once patient started to lose muscle mass is usually on the upper extremity first. Okay, on your temple. Second thing is on your interosus. This one. Okay, you can do like this. Ask patient to do like okay, alright, and then ask patient to to press firmly. Okay, and then you can feel the bulging here. Can you feel when you press firmly? There's bulging. Okay, how do you feel when you touch it? It's a bit firm. It's just a feeling like you fill the balloon with water full and then you press the balloon. Can you feel that?
Yes.
Okay. Somewhat, do you have any flat? Some of you flat perhaps? You don't have any bulging?
What
You
bulging?
have bulging. Okay. Those who have flat is also, please don't worry because it's also common for certain females. Yeah, female usually you have more flat. Yeah, but still you can feel the muscle a bit firm there, right? So in her case, we cannot really feel that, right? So that's one. So another thing, you can actually do assessment on tricep and also on quadricep as well. You can feel the firmness of the muscle, right? And you can also do on the apa?
I'm not as innocent as you think.
No, the clavicle.
Clavicle, okay, clavicle tulang ya. Tapi you nak rasa muscle di bawah clavicle. You going to scoop,
Oh my god.
scoop, scoop inside. Bila you scoop inside, what do you feel?
It's like something is there.
Hollow. Yeah, can be something.
You can feel a bit firmness lah kat situ muscle ya. Scoop inside, bukan pegang kat tulang.
Boleh simpan barang-barang.
Scoop inside it, right? You can scoop inside it, right? And then you can feel the muscle there, right? Of course, if you touch tulang, memang tak rasa muscle lah, right? So there's if the muscle over there is a bit springy, so that indicate that they are using muscle mass. So in this case, that's why this patient is considered as malnutrition. Okay? Any other burning question from members of the floor?
Aku masih lagi flat.
Tak ada? Okay. So I hope I give you some brief overview why nutrition assessment is very important. Okay, I hope that later on when you practice as a doctor, please do a simple screening, okay, and refer to us, right, when your patient need further intervention. Alright, with that, thank you very much and nice meeting every one of you.
Thank you,
Doctor.
Last class for this year.
Terus kau juga? Serius tak?
Yeah, dah.
Ya.
1, 2. Mama 1, 2. Alright. Jom.
Bye.
Bye bye guys.
Hopefully. Last
Hopefully.
class. Sorry.